Hello and welcome to this video. Today we are going to talk about flu, influenza. In the United States, the past couple years during start of the pandemic and last year, we saw flu cases actually significantly drop, especially in 2020, as people were masking. People were wearing masks, and that was preventing the spread of influenza. Last year we saw slightly more influenza cases. This year we are seeing significantly more influenza cases, and here we are, we're not even in November yet, and there are already cases of flu popping up. Now this data that we're looking at here is the weekly U.S. influenza summary update. It says updated October 21st, but you come down here to the map, it also says October 15th, so we'll just assume it's from October 15th, which is 10 days ago. Today is Tuesday, October 25th. Taking a look at this map, you can see green represents minimal flu cases. Red, maroon, and then purple would represent very high levels of flu. And as you can see here, there are some green areas in the northwest. California is starting to turn a little more yellowish green, which means it's slowly increasing there. But then you get to the south. Look at Texas. High level of influenza already. Georgia, South Carolina, Tennessee, already high, very high levels actually in the red. And these moderate, you see moderate colors, orange, starting to pop up in Louisiana, Mississippi, and Alabama. Even over in North Carolina is now moderate. Virginia's moderate, but then you come up to New York and you have high levels already. So it is getting off to a pretty big start. And part of the problem is not enough people have taken the flu vaccine. And there's just not much immunity from the flu because people haven't had it in several years. And take a look at this. District of Columbia, very high levels of influenza. Now, clicking on any one of these would take us to the individual site. Not all states' websites have a very accurate flu tracker, but there was one that I could look at. Let's see, where is it at here? New York State. We could look at New York State, and in New York State, here we go. In New York State, here's the laboratory reports of influenza, including New York City. So on this map, white is no cases. Blue and any types of the blue are greater than, the dark blue is greater than 10 cases. The lighter blue is 5 to 9.99 cases per 100,000 population. So all this is per 100,000 population. And you can see, in New York City, it's starting to go up. Upstate New York, not too much, like far northern tier region, not too much. You come down here to, I believe this is Washington County, New York. It's up a little bit, but take a look at central New York. It's starting to go up, especially the southern tier. There's a few darker blue areas where it's really starting to get a rise. And we know New York State is already being crushed by a pretty significant wave of COVID hospitalizations. I mean, not severe compared to the past few winters, but for this early on, they're getting crushed with COVID hospitalizations. And let's take a look at that, shall we? Let's come down here to New York. Hang on. We're going to come down here to New York, and let's take a look at their hospital situation. Because we're not only dealing with coronavirus, we're dealing with flu, but also RSV. RSV is increasing as well. And the point I'm trying to make here is already 79.79% of their hospital capacity is being used, and we're not even in November yet. They have 3,068 people in the hospital for COVID, 34,280 people in the hospital altogether, plus 42,961 inpatient beds being used. So, if flu keeps going up rapidly, if RSV keeps going up rapidly, they are definitely going to have a capacity issue in hospitals come later on in September. Their neighboring state of Connecticut is already having complications, not so much with flu, but with RSV in children. The pediatric beds in Connecticut are actually full, and they are putting up tents. Yes, field hospital for pediatric hospitalizations is coming in Connecticut. Let's take a look what the media is talking about this. Here we go, New York Times. A triple-demic, flu and other infections returns as COVID cases rise. Fear of a U.S. twin-demic flu, RSV growing with or without COVID. Well, no, we know it's going to be with COVID, so triple-demic is more accurate. Time magazine, the troubling trends pointing to a severe flu and RSV season. So Time's not also mentioning coronavirus. But look at this. Nearly half of Virginia high school out sick because of mystery outbreak like flu. Could it be flu is mutating? It's possible. I'm not going to speculate, but something's going on here. There are a lot of different cases or outbreaks in the country where multiple students, a high number of students in a school at once are reporting out sick. It's happening on the West Coast. It's happening on the East Coast. It's happening in the South. It's really starting to happen around the country, and it seems like it's happening fast and all at once. That's not something that flu would normally do pre-pandemic times. And furthermore, makes me speculate that coronavirus, if someone's infected with coronavirus, it really weakens the immune system and really intensifies these other illnesses, and you're at high risk to get it much easier than you would have been before a COVID infection. But we don't know that for certain, but we can only speculate that something has changed here, because you would never see thousands of kids calling out sick at once before the pandemic. Okay, maybe some would come to school sick, and that would represent some of the people that are calling out now, because we have better health protocols. If you're sick, stay home. But I guarantee you it wouldn't be 600, 700, 800, or in this case, 1,000 students at once. And look at this, here's more of it. Experts warn of severe upcoming flu season as pediatric hospitals already feel the crush here in October. A surge in pediatric patients with respiratory illness is overwhelming hospitals across the United States as experts warn of a potentially severe flu season. Here we go. And now read this. Pediatric bed capacity in hospitals is the highest it has been in 2 years. So mind you, we've been with coronavirus since 2020. And now pediatric hospitalizations are the highest in 2 years. Hospitals are becoming inundated with pediatric patients sick with respiratory illnesses, filling up 71% of the estimated 40,000 available hospital beds. 71% already. Is the White House taking any steps? No. Is the coronavirus task force taking any steps to help with this? No, CDC's not. I mean, something needs to be done. This is early in the ball game. We haven't gotten through the holidays yet, and already we're almost out of pediatric beds. And this is likely only going to get worse. So the takeaway here is we are essentially dealing with 3 pandemics this winter. Flu, RSV, and coronavirus. The hospitals are going to be severely strained, and this is not looking like a good winter. Okay, they're saying COVID, well, it won't be as bad as it. Okay, that's wrong. We are seeing what's happening in other countries. Germany had a swift uptick in coronavirus hospitalizations. Then already, thankfully, already it is somewhat starting to drop in Germany, and I can actually show you that. Let's take a look at Germany's chart here real quickly, and you'll see when I show you Germany here, look, Germany went up with ICU admissions very rapidly with ICU admissions. Now they're starting to drop somewhat, but if we see a rise like that here in the United States on top of severe flu, on top of severe RSV, the hospitals aren't going to be able to handle it. It's going to be a disaster. So, you're going to want to protect yourself the best you can and try and stay away from the hospitals through the winter season. You never want to be in a hospital to begin with. That means you have a serious health problem. But we are really dealing with a serious situation that's going to be unfolding here over the next several months. And we'll just have to watch how it plays out. I assume more states are going to need field hospitals. Alrighty, thanks for watching this video. If you want to see more stuff like this, hit like and subscribe down below. Stay safe, everyone.